When should you go to the ER for a gout flare? Have you ever wondered when a gout flare might requiring a trip to the emergency room? Gout can be incredibly painful, and knowing when to seek emergency care is crucial. You should consider going to the emergency room if you experience severe symptoms that suggest complications or if your condition does not improve with initial treatment. For instance, if you have intense, rapidly worsening joint pain and swelling, especially if it severely limits your movement, that is a strong indicator to seek help. Signs of infection in the affected joint are also serious. If you notice fever, chills, or redness spreading beyond the joint, you may need urgent evaluation for septic arthritis. If your symptoms do not improve or worsen despite taking prescribed anti-inflammatory medications within 24 to 48 hours, that is another reason to head to the emergency room. It is also wise to seek care if you are unsure about your diagnosis. This is particularly important if this is your first gout attack or if your symptoms seem unusual. You want to rule out other serious conditions that may mimic gout. Additionally, if you experience multiple joint involvement or systemic symptoms that suggest a more severe disease course, do not hesitate to seek emergency care. Gout flares typically start suddenly, often affecting the big toe, with symptoms like joint pain, redness, and swelling. Most flares peak within 24 hours and can usually be managed with anti-inflammatory medications. However, because gout symptoms can resemble infections like septic arthritis, which is a medical emergency, a joint fluid analysis may be necessary to confirm the diagnosis and exclude infection when clinical features are unclear or severe. In the emergency department, the focus will be on pain relief using anti-inflammatory drugs, as opioids do not address the underlying inflammation. Long-term management of gout is essential to reduce the frequency and severity of flares. In summary, go to the emergency room for a gout flare if your symptoms are severe, if you have systemic signs of infection, if you fail to respond to initial treatment, or if there is uncertainty about your diagnosis that requires urgent evaluation. Mild to moderate flares can often be managed by your primary care provider or rheumatologist with appropriate medications and follow-up. Always remember to consult healthcare professionals for personalized advice and treatment options.